My name's Tim McDonald, Assistant Policy Researcher at the RAND Corporation. High cost of healthcare is now squarely impacting the middle class, enrollees in ACA exchanges, and those covered by Medicare. So this reveals a truism of the second side of the coin. Patients should have the information and financial incentive to choose better quality, lower cost providers. So the two sides of the coin, if we're going to ask providers to make less per patient, they need to make up for it with more patients. Patients need information and incentives to choose better quality, lower cost providers. So we can measure providers on cost and quality, and then we can share that information with patients and build incentives into health plans that share savings when patients choose better for less providers. So the CGIP system tiers primary care providers based on their total cost of care. And so primary care providers are measured for total cost of care, including referrals and prescriptions and in-hospital costs. That total cost, risk adjusted, then places them into one of four tiers, and members of the program, patients, that select their primary care provider each year share savings for lower cost providers. And the program stands out for a few reasons. So first of all, it puts the primary care provider in the role of coordinator of care. Second, it simplifies the choice process for the patients. Each year they choose their primary care provider, who's then responsible for coordinating care. Is it possible to engage patients as consumers? If so, how do providers respond? And we've been finding that patients do prefer clinics in tiers that have lower cost sharing, and the clinics are responsive by lowering prices. So we're taking what we learn from these evaluations, drawing upon them and other cutting edge research in patient and provider decision making, and we're creating an evidence-based prototype design. And the idea is to create a general total cost of care model built around empowering primary care clinics, empowering patients, and built upon the principles of measuring primary care clinics on total cost of care and then sharing that information and sharing savings with patients. So the idea is to help other large employers and public plans adopt a similar model if they're interested.